Fox 61 Morning News begins now.
Well, mental health issues impact all groups in American life. Of course, the LGBTQ community is no stranger to that as well. The Bristol Hospital Counseling Center is hosting a free monthly mental health and substance abuse recovery series, and next week's session is going to focus on issues within that community. So today, once again, I'm happy to welcome back to the show licensed clinical social worker Michael Miarecki from Bristol Hospital. Thank you so much for joining us. Good to see you again.
Nice seeing you, Tim.
Yeah, glad to have you here. Okay, so certainly people in the LGBTQ community have faced more than their fair share of prejudice. Can you just talk to us about what kind of psychological effect that can have on people in the community as a whole?
So people within the community are experiencing a lot of psychological effects. So being gay in America is kind of making a nice turn, I think. We're getting to a more accepting side of things. However, we still hear every day how it's, not, right, or some of those type of things, and families may not be accepting. So there is those symptoms of depression that kind of kick in, those symptoms of anxiety and post-traumatic stress disorder, especially if people who have been discriminated against their families, or communities and jobs, things like that.
Yeah. What kind of impact does that have, and what do you try to do, at least as a social worker, to sort of help them through it?
So within our agency, for me as a therapist, we talk about how to manage the symptoms of the depression and how to manage the anxiety, how to network and try to get people to resources that may be helpful for them in terms of working specifically within that community. So outsourcing some of our therapy to people who are LGBTQ friendly and or competent, who can help them through all of those issues that they may be having.
Yeah. Are you finding that at least availability to a lot of those is starting to expand more, that now the general population as a whole, I think, is starting to get a more nuanced understanding of sexuality? It's not just gay or straight, and it used to be, hey, straight is good, gay is bad, and that was all there was to it.
I think within this area of the country that's more accepting, obviously. I mean, we're a very, more liberal state in terms of Connecticut. We have limited resources still. I mean, there's limited resources within Connecticut for the LGBT community. However, there are a lot more therapists who are working individually and in the group settings for those who are, LGBTQ, whatever letters we're going to be using. So
right, yeah. I mean, some communities it's LGBTQIA. That's something that still needs to come to more of a consensus as well. You have to deal with well, actually, you know what? I want to talk about the session that you guys are hosting on January 2nd. What can people expect if they go to that session?
So I've been working pretty much with the LGBT community for a very long time, so I feel very comfortable talking about any issues that people may be having in terms of family issues, in terms of any kind of personal issues that people may be feeling. It's not therapy, it's more of an education-based session. Okay. So we'll talk about different therapies, we'll talk about different resources that people can outreach to. We'll also talk about ways how it affects them within their family. So, it's really a lot of education. It's a good group. Ask any questions that you may have. Talk about different acronyms that we have. You have LGBTQ, so we know lesbian, gay, bisexual, transgender, queer questioning, and then we can talk about all the other kind of things that go along with, that, because, there's pansexual and sapiosexual and all of those things that kind of go along with that. So
yeah, it is not as binary as people used to think it was, and it looks like a great first step if you don't know where to go, if you or somebody you love needs help. So here it is again, Tuesday, January 2nd, starting at 6:30 to 7:30 right there at the Bristol Hospital Counseling Center. There's a number on your screen, 860-583-5858 if you have any questions. Mike, good to see you again, sir.
Nice seeing you again, Tim.
Glad to have you here. Well, coming up, accusations about